when you're thinking about your options for breast reconstruction, know that there's a very big difference between something just not being an option for you, all plastic surgeons would agree, and something just being an option but higher risk, and maybe some plastic surgeons wouldn't offer it to you. Let's give some examples. 1, if you've had a thigh lift, you can't have thigh-based breast reconstruction, period. Plastic surgeons are going to agree with me on that statement. You're not going to find a plastic surgeon who's going to do that. That's very different than you found out you have breast cancer, you really want implant-based reconstruction, but you know you're going to need radiation. Are you at an increased risk of complications? Objectively, yes. Will some plastic surgeons offer this to you? Yes, I'm one of them. Will some plastic surgeons not offer it to you? Yeah. And that's where I have the problem. Just because something is higher risk doesn't mean it shouldn't be offered to the patient. You're the patient. You should make the decisions. That's informed consent. So when I have patients coming in wanting to talk about implants but they need radiation, I tell them, you have a higher risk of capsular contracture. You have a higher risk of aesthetic distortion of that breast where you might not like the way it looks. But you also might like the way it looks. You're definitely going to look different when you're naked, but when you're wearing a supportive bra, you can actually have pretty good symmetry. And I see this time and time again in my clinic. What I have a problem with is when plastic surgeons will say, no, you're just not a candidate for implants, you can't have them. What they should have said is that in my practice, I don't offer implants if you need radiation. That's okay. We're all doctors. We all have different ways of running our practice. I offer some things that my partners don't do. My partners offer some things that I don't do. When I have a patient who comes in wanting something that I don't offer, I say, hey, I think you'd be a really good candidate for XYZ. I don't do that surgery. Let me refer you to one of my partners. So if you're seeing this in your consultation, here's what you can say. You're not offering me blah, blah, blah. Let's say implants when you need radiation. Is that the way that you run your practice? Is there another surgeon who might offer it to me? And if they say yes, then ask for a second opinion. But it's really hard for me to wrap my head around plastic surgeons who aren't letting patients make their decisions for themselves based on science, but just doing what feels best for the patients in that moment. Let me know your thoughts below.